segment is sponsored by Springfield Clinic. In studio today, we have Dr. Diane Hillard-Sembell here. And Dr. Diane, you're here to talk about sports medicine and knee injuries. And of course, this is common. We have football season getting ready to start up, basketball season. You know, all these sports are coming back up. Talk about that for us.
Well, this is the first week of football. The scrimmages start this week, and there's certain things that we can do to prevent injuries and certain things we can do to get treatment started in the right way if the injury does happen. So sports medicine doctors are doctors with specialty training, either 1 year or 2 year fellowship, either primary care or orthopedic surgeons, and we are trained to treat and recognize injuries when they happen and get that treatment started very efficiently.
And what's some of the common things that you're seeing, you know, when players are out on the field?
Well, the most common things that I see in my office are knee injuries. Unfortunately, we see a lot of ACL injuries, meniscus injuries.
I hear that all the time, ACL.
ACL is anterior cruciate ligament injury, and it's a major stabilizer ligament in the knee. So unfortunately, when that happens, oftentimes surgery is necessary for the high-level athletes. And while we do a great job of the surgery and getting people back, it's still a long time out. So we'd rather prevent it if possible. Of course, contact injuries we can't prevent, but the non-contact, there are some things that we can do in the off-season and during season to help prevent that.
And what's the treatment like after you go through surgery? You know, is it physical therapy, medicines? What do they have to do?
There's a combination of both. So if someone has surgery, they actually have prehab, so they have physical therapy before to kind of get ready for surgery. After surgery, oftentimes there's a brace involved, and then progressive range of motion strengthening. And very important is the neuromuscular training that then goes into that. So kind of functional training, getting them being able to not just have the strength, but the functional ability to cut and twist and land and have the motion be correct, so that it doesn't happen again or to the other extremity.
Now, is there anything players can do to actually prevent this from happening?
Well, we do have a prevention program. We take some elements from the sports metric program out of Cincinnati and also the program out of Burt Mendelbaum's in Santa Monica, California, and it's called the PEP program. So we have some jump training, we have some very simple drills actually, but it's a matter of progressively adding more and more challenge to the athlete, some straight ahead. So one simple test that people can do, even non-athletes, athletes alike, is to stand on one leg and do a little bit of a squat and make sure that that hip lines right up with the knee and the ankle. So it should be in a straight line during a single leg squat. If it's not, oftentimes the knee collapses in. There's hip weakness involved. That's a very big factor. Most research shows that when an ACL happens, the knee kind of goes inward, kind of a valgus position. So a lot of hip strengthening is involved, and recognizing the deficits and correcting them so that it doesn't happen.
Yeah, you want to catch those signs early to prevent those injuries. Doctor, thank you for being here this morning.
Oh, thank you so much. It was a pleasure.
Of course.